hand over to our speaker for today, Nicole Goble. She is the Director of Community Initiatives at the Caregiver Action Network. And Nicole, please introduce yourself. Tell us a little bit about yourself, and uh, the audience is all yours.
Thank you so much. I'm going to bring up, got some slides that I would like to share as we kind of talk through. So I'm going to bring those up first and then can jump right in.
And Nicole, your audio, can your volume be a little bit louder?
Sure. Let me go in real quick and see if I can adjust my audio. One of those things that can always be a little bit tricky. Okay, is that a little bit better?
Yes, thank you.
No problem. Okay, so you should be seeing the slides here. But basically, what I want to talk through are some of the resources that we at Caregiver Action Network have um, for supporting caregivers that are caring for a loved one with rare disease. So I want to take a moment to thank Cure and the Pros Foundation for making today possible for us. We're really honored to be here and to be talking about the resources that we have. So a little bit about me. Uh, as I was introduced, my name is Nicole, and I'm the Director of Community Initiatives at Caregiver Action Network. I've been with the organization for 7 years, and I actually come to the organization with a background of working with youth with disabilities. I myself was born with a rare disease, and so um, I spent in working with youth, spent a lot of time working with families as well. So I was really excited to get the opportunity to really hone in and focus in on caregiving in a more expansive way as well. So, a little bit about Caregiver Action Network. This may be the first time that you're hearing about us, but we are the nation's leading family caregiver organization working to improve the quality of life for the millions, tens of millions of caregivers across the United States. And so we're really looking at the lifespan. So individuals that are caring for a child that's been born with significant healthcare needs or rare disease, a spouse that has been diagnosed with cancer, a sibling with an intellectual or developmental disability, or what many people, I think, may more stereotypically think of as caregivers is individuals that are older, and we provide supports for those caring for those older individuals with their life needs. So these caregivers represent a wide array, obviously. I touched a little bit on the lifespan aspect, but we also look at some of the unique categories that caregivers can fall into, things that really impact kind of their caregiving situation. So there are new caregivers. So caregivers that are just starting out on their caregiving journey. And again, that can speak to anyone um, that I referenced earlier. But so many caregivers struggle with, where do I start? Where do I turn to at the beginning? There are folks that have been caregivers for many years. Again, this can be someone who's been caring for an individual with a rare disease or a chronic condition, and it's been ongoing. Lots of caregivers who have been in that position will come to CAN to find more resources, new resources for kind of their tool belt caregiver supports, working full time and being a caregiver. A lot of recent data supports that many caregivers work while balancing caregiving, and those caregivers face some really unique challenges on being able to balance those responsibilities. And so, being able to find some resources and supports to help make that balancing act a little bit more feasible and help minimize some of that caregiver stress and burnout is really imperative. And then long distance caregivers. So folks that um, live away from their loved ones. I'm also a long distance caregiver. My mom was diagnosed with advanced COPD and lung cancer. I live in Washington, D.C. She lives in Iowa. But just like she would say that she is my long distance caregiver, I'm her long distance caregiver too. And so being able to care from a distance, whether it's across the state, across the country, we even have partners that are international and are caring for loved ones in another country. Um, it can be really difficult to know how to stay diligent and present in your loved one's care. And so we have resources for that as well. So, a little disclaimer that I like to give at the beginning of any presentation is that what we're talking about here and what I'm going to be touching on are some uh, resources and some pain points of caregivers. And every caregiver's situation is different. Those tens of millions of caregivers I referenced, each caregiving situation is going to be a little bit different. It's going to be impacted by a number of unique factors based on a lot of different circumstances, your loved one's support needs, etc. So, while there may be some things that may not feel like they resonate with your particular caregiving situation, I challenge folks to think about how they may um, be utilized in some capacity if there's something that is able to be taken away, or think about how caregiving changes. Um, Regardless of your caregiving scenario, one thing is true: caregiving changes. Day to day can look very, very different. Our loved one's disease or condition with symptoms can change, and we need to be able to adapt. And so think about how some of these resources may be able to be utilized in those scenarios as well. All right, so let's get into some meat here. And a lot of what I may touch on may be things that you're familiar with, because I know I'm speaking with folks that are caregivers. But I think sometimes thinking about these things, getting refreshers, and perhaps having a different perspective can be really, really useful. So I want to start out by talking about the pain points being a rare disease caregiver. So, big one is access to information. So, I know in my situation, it was really, really difficult for my mom to find information about my condition, to find specialists, to find um, things that were really, really pertinent to my treatment and management of my condition. So that's one of the huge pain points and barriers for caregivers. When you're caring for someone with cancer, Alzheimer's, Parkinson's, there's a lot of information out there. There's a lot of support groups. There's a lot of different kind of accesses to information. But when you have a loved one with a rare disease, that can be really limited. The second point I think is really, really important to underscore here, and that is you as a caregiver may need to become an expert in your loved one's condition and have to take on the responsibility of educating others. And yes, this can mean your loved one's healthcare providers. I know that there have been many situations in my life, both in my youth with my mom, but even as an adult, where I have to give a breakdown of my condition of having Turner syndrome. And so, and this is with healthcare providers. So, you really have to take on that responsibility of knowing a lot more, perhaps, and have kind of a different level of expertise. And that can be a huge burden. So, like I said, um, you may have difficulty finding access to different kinds of resources, specialists. My specialists were over 2.5 hours away from where I lived. Grew up in a rural area. And so for me to go to specialists, we had to go 2.5 hours um, away. And that was a real struggle for my mom, who was a single parent and working. And so access to those things um, can be a huge hurdle. Things like occupational speech therapy and clinical trials. Depending on the condition and also other factors, like I said, living in a rural area, we know that there are barriers to information and access to resources there. All these things can be really difficult um, to have access to. Access to community. Now, I would say that this has changed a little bit in recent years because now we're all very connected virtually. It wouldn't have been such a struggle for my mom to find a support group of other parents of kids with Turner syndrome. And it wouldn't have been difficult for me to find other kids with Turner syndrome to talk to. But I grew up a little bit before the time of the internet, and so I didn't meet another person with Turner syndrome until I was in my 20s. And I don't know if my mom ever has really connected to like a full-fledged support network. I think she has in more recent years, but um, I think that you know, we as caregivers now really relish in the ability to have that ease of access to talk to other caregivers because we know that that's such a crucial, not only support network, but also such a great place to share and to learn from other experiences. So, um, I think kind of connected to that is that even if you don't find someone who um, may have that lived experience of caring for someone with a specific condition, or maybe you're navigating a road of having someone that is undiagnosed. It can be really, really difficult to find someone who has that lived experience, where lots of people have lived experience of someone that they know, either family, friends, etc., that have lived with cancer, things like that. And so when we're talking about rare disease, undiagnosed, being able to connect with people that even have a point of reference for that can be really challenging. But I do want to hit on some pain points that are shared by all caregivers. One of the things that uh, a former colleague of mine used to say is that um, a majority of pain points are shared by all caregivers, and there's a smaller subset that are uniquely specific to folks within different disease and condition states. And so I think it's really important to hit on some of these because it's a very unifying, I think, point. So, as I mentioned before, balancing work and caregiving duties. Um, Lots of caregivers work, and being able to provide that care while being on the clock is a huge burden. It can impact an a caregiver's ability to stay employed. It can impact a caregiver's ability to progress within an organization, and it may lead to an individual needing to leave their place of employment. There's some really interesting data about folks who had to either leave their work, retire early, or take a leave of absence. And a lot of the reasons were that were given around that were that folks needed to provide more care for their loved one. They needed more time to dedicate to caring for their loved one. A number of folks said that referenced benefits. So, paid time off, flexible work hours, hybrid work situations. Again, some of this has changed in very recent years as a result of the pandemic, but having those workplace benefits also is really crucial to making folks uh, schedule a little bit more feasible in balancing that care and work. Time management, um, being able to juggle all the things that are simply on your plate as a caregiver is challenging. And so time management is a huge thing for all caregivers. What we call role overload or overload. A lot of folks feel that they get absorbed in their role as a caregiver, and other factors get pushed off to the back burner. It can be other relationships, friends, and family. Um, it can be hobbies and passions that are set aside because it's hard to simply find the time to have those things and also provide care. And of course, finances. Many caregivers speak to financial strains, some quite significantly. There's a lot of out of pocket costs that caregivers have to take on, and that can be a huge challenge. So, some of the impacts of caregiving. So, hit on a bit of juggling work and care responsibilities, but what are some other impacts? Increased stress and burnout. So, time management, balancing your duties as a caregiver, and maybe it's not work, even balancing other roles that you have within a family. Um, Maybe you're caring for more than one person within your family. Um, Time, balancing all of those responsibilities can lead to increased stress and burnout. And one of the things I want to hit on is that the way that stress and burnout um, kind of work together is that stress is stress. We all experience stress to a certain degree. Obviously, caregivers experience a certain higher level of stress more frequently. But when we are unable to deal with those stressors, find ways to work with those stressors, alleviate those stressors, it can lead to burnout. It's kind of the piling on of that stress. And then complex emotions. All caregivers, I think, have complex emotions: anger, resentment, guilt, things that can be really challenging for us to put voice to. And this is across any caregiving scenario. And again, I think this speaks to why it's so crucial to have a network of caregivers that you're connected to, because you have a network of folks that can, I think, understand those feelings and can give you a space that you feel comfortable sharing that. It might not be something that you are comfortable with sharing with other family or friends because you may feel like they won't understand. I want to talk about the importance of practicing self care. One thing I want to really firmly state is that self-care isn't selfish. This kind of goes into the role overload and how caregivers can lose themselves in the role of caregiving. We often, as caregivers, feel that we need to make sacrifices and put even our own mental, emotional, and physical health um, on the side to care for our loved one. We make sacrifices of, I'm not going to go to this doctor's appointment because I don't have the time. But prioritizing your physical, mental, and emotional health is really crucial to making sure that you can continue to care for your loved one. If you're not doing well mentally, emotionally, or physically, it's going to make it so much more challenging to provide that care. for your loved ones. So it's important that you are addressing your own physical, emotional, and mental health. Just like all aspects of caregiving, self care is very personal. Uh, how you view self care, what self care is to you, is going to be based on your preferences, time. A lot of people think that self care has to be this really extravagant, time um, expansive, or something that costs a lot of money, but it doesn't necessarily have to be. It can be taking 30 minutes out of your day to have coffee and just have some downtime. It can be practicing yoga. Um, again, making sure that you're prioritizing your physical, mental, and emotional health, going to those medical appointments, going to therapy appointments. All of those things can qualify as self care. So, one of the ways to address self care and help make that a priority is by utilizing what we call the 10 tips. And the 10 tips are really great because I think it's a nice balance of some logistical pieces, um, as well as things that really focus in specifically on self care. And I think you'll get what I mean as I go through these. So, as I mentioned, seeking support from other caregivers. Caregiving can be really isolating. Even if we know kind of in our brain that there are other people that may be uh, having similar experiences in the same boat as us, uh, it can still feel isolating if we're not directly connected to other caregivers. So finding that support from other caregivers is really important. Again, taking care of your own health is so crucial. And so, keeping your own medical appointments, physical fitness, all of those things. Again, these are things that can easily be put on the side when we become caregivers. But it's important to know that if we're not taking care of ourselves, it's going to be harder for us to take care of our loved ones. Accepting offers of help. This can be really, really difficult. I'm going to talk a little bit more about asking for help, but when other family members, friends offer help, um, it's important to say yes if there is something that they can chip in with. It's important to know that you can't do it alone. Communicating effectively with healthcare professionals. So, one of the things that I hit on earlier is that as a rare caregiver, or navigating kind of an undiagnosed journey, you have to be an expert. To some degree, all caregivers need to do this because caregivers are a crucial piece of the puzzle for doctors. Caregivers are with their loved one more than any healthcare professional. And so, healthcare professionals really need to rely on those caregivers for additional insights and for to help kind of underscore some of the things that may be going on, especially if patient maybe um, have some difficulty with communication, things like that. But even outside of that scenario, a caregiver is often just there to be an advocate and to help their loved one better communicate maybe different symptoms that are happening, things like that. So, learning how to build a rapport and learning about how to finesse good communication with healthcare professionals is really important. And often that starts with self identification, letting the doctor know that you are a caregiver, that this is the kind of role that you play in your loved one's life, so that they have that understanding of, oh, well, now I know kind of what information I may be able to ask, or get clarification on. Be open to new technologies. There are an endless number of new apps, of new gadgets that are coming out that can help alleviate um, some of the time management stressors that caregivers face. I mean, even things as simple as deliveries of medications, um, I think, and even groceries, food, um, very key for long distance caregivers, but are things that can help kind of chip away at some of those time management stressors. If your medications can be delivered, that's one less thing that you need to kind of build into your schedule of I need to stop by the pharmacy and pick this up. Watching out for signs of depression. So we know that caregiving takes a physical and mental toll on caregivers, and it's important as part of your um, kind of self care to be on the lookout for when some of those emotions, sadness, um, tiredness, exhaustion, lethargy, feel a little bit less manageable. And make sure that you're communicating that with your uh, your healthcare providers. We actually have on our website a screener tool, and we worked with Mental Health America to make available a screener tool where you can go through. It's not a diagnostic tool, but what it does is it helps kind of identify some things that you can use to talk to your healthcare provider so that you're not missing out on anything crucial. You're able to communicate symptoms, etc., and you're able to get the help that you need. Taking breaks, respite care, getting good sleep. Um, Respite can kind of fall into a category of self-care as well. Being able to take a break, whether that is taking time for yourself, or even if it's just running errands and you need someone to be there with your loved one, being able to have that um, is important and something that can be really difficult for caregivers to find access to. For some, it can be other family members or friends. That can be a huge, um, I think, asset there with that expanded care team. Or there are organizations and even volunteer services that provide respite care. So, respite care is really, really important, and it's important to take those breaks. It all feeds back into that mental and emotional well being. Organizing medical information so it's up to date and easy to find. This is really important, especially for caregivers that are working within an expanded care team. So, for a long distance caregiver, maybe there are other um, family members or friends that are also helping out with different appointments. So, being able to have all of the updated information together and accessible to members of the care team as appropriate is important so that everyone is up to date. If I take my mom to a doctor's appointment when I'm at home, and we change her medication, but that isn't communicated to my niece or nephew who assist when I'm not able to be there, um, that that can cause a bit of a communication breakdown between caregiver and healthcare professional, and everyone needs to be on the same page. So making sure that all of that medical information is together to date. Thankfully, there's lots of apps and ways to do that electronically. I know back in the day, my mom would have like a big binder of documents that she kept for me. So I'm very happy that now we have apps that I can kind of keep track of things. But you can also navigate how that works for you. And again, maybe that expanded care team. Legal documents are up to date. So this is really important that this is kind of included in what we call the patient file. So that can include those medical records, but also legal documents, DNRs, etc. Those are really important to have together as well. And last but certainly not least is to give yourself credit for doing the best that you can for your loved one. We can always feel that we're not doing enough. We can always feel that maybe we're falling short of what our caregiving should be, second guessing ourselves. But the fact that you are there and supporting your loved one, providing care, um, is important to give yourself that credit for. All right, so like I said, I'm going to dig in a little bit further into asking for help. Asking for help, yes, is a bit of self care. A lot of caregivers will feel that they have to take on all aspects of caregiving themselves, by themselves, without any help. And that's simply not feasible. We all need help. We can't do it alone. So it's important to accept that we all need a little help from time to time. And whether you're asking for help or accepting those offers of help that we referenced earlier, that's okay. It's completely normal. It's completely appropriate because we can't do it alone. Asking for help is not a sign of weakness. Again, we take on a lot as caregivers and we feel like we need to do it all. And if we find a certain um, at a certain point that we do need help, we can feel like we're letting our loved ones down. But that's not the case. You're still doing what you need to do to make sure that your loved one is getting the care that they need by asking for that help or accepting that help. So it's important not to look at that as a sign of weakness, but rather part of your role as a caregiver. Knowing what you and your loved one need. Now, I don't know about you, but I have been in many instances where someone has asked me, "Do you need any help?" And I have that moment where I kind of stare at them like a deer in the headlights and I say, "No, everything is great, everything is fine." When in fact, maybe an hour later, maybe a day later, maybe even a week later, in my mind, there starts popping up all these things like, wow, I could have said this, I should have said this, because that really would have been great to have that help with. So, what we like to encourage caregivers to do is to start making a list. This kind of gets at two different components that caregivers may struggle with. One is, again, we feel like we need to take it all on ourselves. And being able to identify maybe one or two things that we're okay with having other folks help us with or chip in with um, can be really good thing. So making that list, going through, like, is it okay if I have another member of the care team do this? Um, and then the second part to that is being able to share that list, keeping that list kind of accessible so that when you get asked, is there anything I can help with? You have something to reference. You can say, oh, yeah, actually, um, you know, my loved one has a doctor's appointment next week and I'm not going to be able to take them. Uh, would it be possible for you to give them a ride? Things like that. Um, but also share that list with the care team so again, they know what you need, what your loved one's needs are, and they can chip in. Okay, so we've talked about the pain points, we've talked about ways to prioritize your self-care, and we've talked about the importance of asking for help. Now I want to share some of the resources that we have to not only build in resources for you as a caregiver, but some that can help put that self care into practice. So, one of the things that we do have on our website, and you'll see the web address there on the slide, is we have a special section dedicated to resources that we've designated specifically for rare caregivers. So, dealing with some of those pain points that I referenced at the beginning, we have a number of different resources that talk about some of that and how to navigate. We also have a family caregiver toolbox. And so, what's really cool about our toolbox is that you can go in and search in lots of different ways. You can search by disease or condition because we have been really steadily building up our disease and condition specific content. But you can also search by topic if you're looking for a specific topic, or again, going back to some of those caregiver scenarios I referenced towards the beginning of, I'm looking for resources of being a long distance caregiver or being a new caregiver. Or you can just search the toolbox by keyword as well. So lots of ways to kind of tackle sifting through our plethora of resources. And our toolbox is really our hub. And like I said, we are constantly adding new resources. One of our newest resources that I think is really important to underscore here is we're engaging in a campaign called Risk Less, Do More. And what this is really focusing on is the importance of preventative care, especially around vaccines. We're getting into flu season, all of that. And part of managing our loved ones' healthcare, medications, all of that is also making sure that we're being mindful about preventative care. And so we're helping raise awareness about um, vaccinations and preventative care around conditions like RSV, flu, and COVID-19. So, especially for folks that are perhaps immune compromised or are more susceptible to these illnesses, something especially important to hit on. Clinical trials. As I mentioned before, clinical trials can be a huge part of a rare caregiver's journey. I was part of a clinical trial as a kid, and so we have a specified resource that helps caregivers navigate a clinical trial, how they support their loved one through clinical trial. Clinical trials can be a little overwhelming and can cause some hesitation in some caregivers because there's some unknowns. And so we help break some of the myths around clinical trials so that caregivers can feel really, really comfortable and feel more, I think, prepared and empowered to support their loved one going through a clinical trial. One of our big, uh, big resources is our caregiver help desk. Like I said, so many caregiving situations are super, super, super unique, and you're going to have specific questions, need some specific resources or connections to services, and being able to reach out and find that one-on-one connection to help kind of navigate you in the right direction is amazing. And so that's where the caregiver help desk comes in. You can reach out via phone. The phone number is right here. But if you go to our website, there's also the ability to connect via chat. There's an orange button that says help desk on the bottom right hand of our website. And then if you click on the caregiver help desk button, it will also prompt you to send an email. So lots of ways to reach out, but you will get that one-on-one connection. Now, a couple of things I do want to underscore with this. It's not a crisis support line. So if you are in a crisis, obviously you want to utilize those. It's also not a 24/7 support line. It is Monday through Friday, 7 a.m. to 8 p.m. Eastern. But as someone who works with some of the caregiver help desk staff, they are super amazing about getting back to folks within a business day, to max. So you never have to feel like you're kind of waiting in the lurch. Your feedback matters. we do a lot of these presentations. So getting feedback from folks, I think, is really, really crucial. I'm happy to share a link to one of our surveys, just a few questions to kind of help us know how we're doing and help identify maybe other topics that groups like this may be interested in learning more about so that we can kind of take that into account both within these presentations but also in the resources that we develop. So I'll that in the chat. And then I'll leave us here on how to stay connected with CAN, our website, the help desk number, the info at caregiveraction.org email address. I know that some people are leery about info at email addresses, but I am actually one of the staff that checks that. So if you send an email to info, you will probably hear from me. Also, I want to hit on our social media. National Family Caregivers Month is right around the corner. It's in November, and we're going to be doing a lot on our social media. The theme this year is I Care, and we're really highlighting just kind of the unique stories of caregivers, why folks care, how they define caregiving. So it's a really exciting time. And so if you want to be involved, see a lot of the amazing stories from caregivers as well as share your own. Make sure to be following us on socials. So yeah, that's what I have. And so I can open it up to questions.